good evening. It's 8:30 in the evening. We'll wait for a few people to join me. Just a few seconds. I'm Dr. Melva. Thank you for joining me if you're watching the replay. Just waiting a few more seconds. All right, so I'll go ahead and get started. Good evening, everyone. I'm Dr. Melva, your Board Certified Radiation Oncologist, and I appreciate you coming and spending your Friday evening with me as we have a cancer chat. The topic today is cancer caregivers. Good evening. Feel free to join in. Thank you for joining me again. This is Dr. Melva, your Board Certified Radiation Oncologist, and this evening we're going to talk about cancer caregivers. God bless you. So I have a 3-year-old who will be joining us for the broadcast this evening. So before I get started, I just wanted to say that prayers and thoughts go out to all of those who were affected by today's tragic events in New York. Thoughts and prayers. It's a very difficult time to be in healthcare, and I think that it says a lot that we need to be very open and willing to talk about mental illness. There's a lot of supportive physicians in that arena, and I wholeheartedly support them. Thank you for that. So love and prayers to all of those who were affected, and I think that includes all of us, especially as a physician. So that brings me to tonight's talk. So again, if you're just joining me, I'm Dr. Melva, your Board Certified Radiation Oncologist, and I wanted to talk about a recent study that was published in the Cancer magazine about the effect of cancer on caregivers. One of the largest studies was done by Dr. Schaefer at Memorial Sloan Kettering. Oh, thank you. Thank you for joining. Thank you for that. One of the largest studies was done. Hey, Leland, can you be a little quiet? This is life with a 3-year-old. One of the largest studies was done looking at the effects of health, and the title of the study was Cancer Caregivers at Risk for Depression and Health Decline. So I wanted to talk about that for a little bit from my standpoint. So when I see a patient who has been diagnosed with cancer, I'm not only taking care of the patient, but also the caregivers, the family, the loved ones. And it's a super huge, hey, Dr. Volney, thanks for joining, Dr. Renee. It's a super huge burden on the cancer caregivers. Hello, and wanted to address a few things. So the research found that cancer caregivers are a vulnerable population for being at risk for steady decline in their own physical health. The study looked at about 600 patients and found that from the time of diagnosis, about a year after the patients with cancer were diagnosed, that the caregiver's health decline was the same. But looking 6 and 8 years later, the physical health of those caregivers continued to decline. One of the number one reasons for that is depression. So that's why I was saying that mental illness is something that we absolutely have to talk about. Depression, not being silent around it, making it okay to speak about it. It affects everyone, including my patients who have cancer, the caregivers, whether that's, thank you, thanks for joining, Miriam, how are you doing? It affects everyone, so we have to talk about it. So the study found that years later, the effects of being a caregiver led to depression, and that impacted their physical health. Let's see, some of the and this has been documented before, but the study was supported by the American Cancer Society, and just wanted to bring it to your attention. So 3 tips that I'd like to give you. It's Friday night. I have a 3-year-old here. I appreciate you joining me, but I just wanted to raise these few points. So 1, when you're a caregiver of a patient with cancer, I have all of my caregivers do what I call a carecation. Okay, that's CAR-cation, C-A-T-I-O-N. So just like the staycations when you're doing the budget, or the baby moons or a holiday, you have to allow yourself to take a break. You have to take a break. So whether that's bringing in a home health care nurse, having another family member that's not the primary health care or caregiver provider for the patients with cancer, give yourself a carecation. Number 2, you have to be open for support. So what that means is that you have to speak up, you have to talk about the demands on your time, on your life, on your mental ability. Thank you for that. There's support groups. If you don't know of any in your area, you can start with the American Cancer Society, and like everything else, you can Google it, right? Cancer Caregiver Support Group. There you go. We sometimes make things very hard. Religious organizations, a lot of churches, mosques, other organizations, thank you for that, have a lot of support for those who are caregivers. And it doesn't necessarily have to be for patients with cancer. It could be for any caregivers. And there are other organizations that are also out there for support. So number 2 is to be open to support. Number 3, and just before I say this, I want you to know I am a little biased. My father and my sister are both family medicine physicians for primary care. So number 3 is, as a caregiver of a cancer patient, please do not put your primary care visits with your general provider, your family physician, your general practitioner. Please don't put those off. I cannot tell you how many times a caregiver has turned into a patient with cancer because they put their health and their needs off until they could deal with what their loved ones were going through. It's admirable, but it doesn't have to happen. So don't put your health off. That colonoscopy that you put off because you don't want to take the prep to go and put a tube up your butt and it's uncomfortable. If you're over 50 years old, you got to do it, okay? Don't put it off because you have to take your loved one, family, or friend to the doctor and to the visits. If you're getting radiation therapy every day, or if they're getting chemotherapy once a week or every 3 times a week, it's okay to go back to number 1, which is a carecation, and number 2, support groups, so that you can, number 3, take care of yourself. Because at the end of the day, thank you for that, because at the end of the day, if you're not taking care of you, you're not going to be able to help your loved one. It's kind of like when you get on the airplane and they say you have to put your oxygen mask on first before helping others. That's exactly what you have to do. So again, I appreciate you joining me for this quick broadcast. Prayers and love go out to everyone who was involved today in the New York tragedy. We have to speak up for mental illness. We have to be willing to take a carecation for ourselves, number 1, whatever type of caregiver we are. Number 2, we have to be open to support and talk about our feelings and what's going on with us. And number 3, you have to see your primary care physician for your visits as a caretaker. Thank you so much, Miriam, for that. I appreciate you all joining me. I hope this was helpful. Again, I will link the article, summation from the American Cancer Society, that talked about cancer caregivers at risk for depression and health decline. I'm Dr. Melva. You can follow me on all social media channels at doctormelva, DoctorMelva, or find me on doctormelva.com. I love you. Until next time, thank you so much for joining. Thank you, Dr. Darko. Mwah. Bye.